Arua is a district of 1,011,464 inhabitants. The population in Arua is high, partly because it straddles Uganda's borders with the Democratic Republic of Congo and South Sudan. Naturally, due to the high numbers, health service provision is a challenge. Arua Regional Referral Hospital serves all the districts of West Nile, leaving Arua district with 39 government health centers. Only 4 of these are health center 4s, where a majority of surgical procedures take place. For a proper procedure, the importance of anesthetic officers cannot be overstated. These officers administer pain relief medication to patients just before surgery and also support in other surgical interventions. Unfortunately, Arua district does not have anesthetic officers.
We have anesthetic assistants. In situations of emergency, they may do, but for ethical reasons and for the skills, this is a lower cadre.
To paint the picture, imagine having to undergo surgery with only one doctor and an anesthetic assistant who is not fully trained, but he is your only option. The only anesthetic officer the district had retired 3 years ago. It is expected that one will be available for recruitment 4 years from now.
There are some things that the anesthetic assistant may not be more competent to do. For example, when a patient gets a cardiac arrest as a result of an anesthetic complication, it may be too much for an anesthetic assistant to handle.
At River Oli Health Center, the role of anesthetics is vital in obstetrics due to the high number of emergency cesarean operations. With the closure of the regional hospital's outpatients department, Oli serves 3,000 outpatients in a month, but has only one doctor, who is also the surgeon. On average, in a month, 32 operations are carried out by the surgeon with the help of an anesthetic assistant.
For any operation that you do, any procedure that you do, anything can happen. That means you'll need the help of an anesthetic officer at any time.
Hiring of these officials is the responsibility of local governments, but the main impediment is wages. Some health centers in refugee settlements have fully trained anesthetic officers hired by implementing partners.
These officers have at U5. U5 is about 1.2 million.
The Ministry of Health says there is a training program in the offing to attract people into this highly specialized field.
We appeal to the district service commissions to continuously advertise to attract these cadres, because in a theater, when an anesthetic officer is absent, an operation cannot take place.
Besides the lack of human resource, Oli Health Center often runs out of anesthetic agents, such as local and spinal anesthetic drugs and switchers. Also, operations cannot be carried out at night because there is no housing for the surgeon and the anesthetic assistant, who lives 10 kilometers away from the health center. Gillian Nantume, NTV.